They won't tell you, oh, it was comfortable, I enjoyed, the dentist was gentle. They tell you it was scary and the instruments were scary. Hi guys, thank you so much for tuning in, and this is Hawandes. I am still practicing how to speak into a microphone and how to look into the lens as we try and practice the video taking sessions. And today, as I practice, I'm going to tackle a very common issue, that is fear of the dentist. First, I have to acknowledge that it is a real fear. It exists. So if you feel that maybe there's something wrong with you, no, I want to reassure you that there's nothing wrong with you. And dental phobia or dental fear is real and it exists. That being said, there are many reasons why you may have dental phobia. For most people, it started when they were very young, and probably their teeth were being removed at home. If it was a traumatic event, then chances of you having dental phobia or not wanting anyone to touch your mouth are very high. Another issue would be a previous dental procedure that was traumatic or very uncomfortable that can cause dental phobia. Hearing stories, I mean, when people leave the dentist's office, they won't tell you, oh, it was comfortable, I enjoyed, the dentist was gentle. They tell you it was scary and the instruments were scary and it was a scary experience and the sounds were scary. So most of the time, the picture you have of a dentist is a very scary place or a very scary person. And then, of course, I'm very used to the first sentence I hear when any patient comes. Okay, let me say majority, because there are others who are very different. They usually say they hate dentists. And then, of course, there's also the anxiety that is there, which makes it even worse. And you only go for the symptoms. And once the dentist sorts out that symptom of pain, you disappear again. Yeah. So it becomes a very vicious cycle. And with time, you find that you will end up being very miserable. You live your life in pain, in fear. You have discomfort. You can't eat well. You can't speak well. It's just not a very pleasant place to be. So dental phobia is something that you need to handle early and try and find ways to overcome the fear. So some of the coping mechanisms include, you can get a good support system, like you can get a friend to take you to the dentist, and then avoid going when the dentist has very many patients. So that means you stay outside waiting for so long, you hear the sounds, and the anxiety becomes worse. So if you go earlier, the better. Communicate in advance with the dental team so that the dental nurse and the dentist are aware that you have a phobia. Then that way they'll be able to manage you accordingly. If maybe you have a phobia of seeing the instruments, they can make sure that you don't have the instruments are not put in plain sight or in view in such a way that they can scare you. Something else that can be done will be, you can go with earphones. Probably if the noise or the sounds are scary for you, you can put noise blocking earphones, or you can put music and just find your happy spot or happy place while you're at the dentist. Then you can get stepwise, like you can desensitize slowly. Like let's say on day one, you can just go get to the reception, fill in forms, and then go. And then you come another day, have the checkup and x-rays done, and then you go. And then you come another day now for maybe just general cleaning, nothing major, then you go. So that you desensitize slowly and slowly until now the brain realizes that there's not much to be scared about at the dentist. And these among very many ways of managing the dental phobia. I have not exhausted the reasons for having dental phobia, but generally those are most of the common ones here. And the problem with dental phobia is it prevents you, I mean, when you have this fear, you don't want to go to the dentist. So you don't go for your annual checkups, because of course, you know, it's recommended that you see the dentist at least twice a year or once a year. So you don't go. And then if there are any problems, they are not tracked in time or diagnosed early. So the dental problems become worse and worse. And you find that the more the teeth pain, the worse the phobia gets. And then now you only go to the dentist when the pain is excessive or too much. And then there are very many ways to cope. I think the best way will be to make a video, a separate video just for dental phobia, or just to keep discussing these ways one at a time until you finish them. Because as I said, I'm not trying to create dentists out of my viewers. I'm just trying to give information and share, so that you can now get back to me and give me specific experiences that you have. Then we can deal with that at an individual level. Sawa sawa. My goal is to help at least one person at a time to overcome their fears and seek dental treatment, so that they can have a healthy mouth. And remember, if you take care of your teeth, they will take care of you in old age. Sawa sawa? Yeah, so brush and floss every day, keep it locked, and if you have any questions, please let me know, then I'll be able to answer for you. So, brush and floss every day. 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 Brush and floss